changing world where we are living, things are pretty uncertain, specifically when it comes to managing health. Growing up, we learned that people would retire at the age of 60 to 65 and sadly die as they grow up to 70 plus on average, but that isn't the case anymore. As per a research, a third of the people born in the UK in 2018 can expect to live up to 100 years. The society we will live in will very soon be quite different to the one we know. Which brings us to an important question. How do you manage the health of a population that includes millions of people over 100? In healthcare, we often draw on the experience of the past to manage the present and address the needs of sick patients. This experience-based model has served us well in the past, but I believe there are some fundamental shifts in our society which will change our focus. Specifically, if we want the public healthcare to remain viable under ever-increasing strain on the system. Answer to the question why and how blockchain and AI are not an option but an essential missing piece of the healthcare puzzle, then keep on watching. In this video, I would be only touching the basics of blockchain and AI within the healthcare sector. I'm planning to make extensively in-depth research-based videos on the role of blockchain and AI within the global digital healthcare sector in the future. So, if this subject interests you and you like my content, do subscribe to my channel. Don't forget to turn on your notification bell so that each time I upload a new video exploring the role of disruptive technologies within the healthcare sector globally, YouTube notifies you. Disruptive technologies such as blockchain may not seem a holistic solution for the challenges faced by healthcare industry today, but the fact of the matter is that it holds a huge potential to save billions of dollars and millions of lives. But to focus on our focus, I'll talk about how millions of lives can be saved by blockchain and AI in another video. So how can blockchain save billions of dollars? By making most of the current workflows also called resource optimization and disintermediating some high-cost gatekeepers. Speaking of gatekeepers, as you must know, these are the people who control access to something or someone or some resources. In easier words, gatekeepers have full access to the resources. Therefore, we can say that an important role within healthcare industry is that of a gatekeeper who controls a patient's access to specialist medical services. For example, if you need to see a consultant or a specialist doctor here in the UK, you are dealing with a gatekeeper who is your general physician or GP who has the power to or not to refer you to a specialist doctor. Similarly, one of the biggest potential of AI or artificial intelligence, a hugely promising disruptive technology within the healthcare, is to help people stay healthy so they don't need a doctor, or at least not as often. When we talk about AI in healthcare, some pretty exciting things such as surgical robots pop up in our minds. Nevertheless, AI has also the potential of simplifying the lives of patients, doctors, and hospital administrators by performing tasks that are typically done by humans, but in less time and at a fraction of the cost. If you are a tech geek or a tech investor, fraction of a cost must be music to your ears and something that you should really focus on, leading us to the question, how? Let's see an example. AI is already being used to detect diseases such as cancer more accurately and in its early stages. According to American Cancer Society, a high proportion of mammograms produced false results, leading to 1 in 2 healthy women being told they have cancer. The use of AI is enabling review and translation of mammograms 30 times faster with 99% accuracy, reducing the need for unnecessary biopsies. Now let me share another really promising predictions by PwC. By 2030, which is literally in less than 10 years from today, AI will add up to $15.7 trillion to the world economy. And as a result, global GDP will rise by 14%. Similarly, Gartner predicts that business value added by blockchain technology will increase to 3.1 trillion US dollars by the same year. Collectively, we are talking about 18.1 trillion US dollars added to global economy. Now, this is some big claims promised by both technologies. But why would or should or must healthcare industry be really adapting disruptive technologies? There are many reasons, but I'll stick to these two. The first is increasing legislative pressure to reduce healthcare costs, and the second one is ever increasing competition. Healthcare industry has undergone massive disruption on multiple fronts. On top of that, legislative pressures also places a renewed emphasis on reducing healthcare costs while improving care outcomes, which puts providers and payers under increasing competition from both new entrants and global juggernauts looking to expand their presence in healthcare. Furthermore, the rapid adoption of EHRs or the electronic health records, as well as the proliferation of wearables and mobile health applications, has created an explosion of health data, creating new opportunities for healthcare companies and their competitors. On the side note, whenever you hear about data, my words may sound repetitive, but it's true that there isn't any technology more powerful and more accurate and more secure than AI and blockchain combined to process patients' confidential and sensitive data. Needless to say, the winners will be those who can quickly drive and or adopt innovation at scale. As a result, this industry transformation has put a renewed focus on business agility. In response to disruption, healthcare enterprises have leaned more than ever on IT for obvious reasons, such as to help them transform their operating models and or improving patient engagement and or supporting new models of care. As competition in the healthcare ecosystem increases, driving innovation along these focal points has become a prerequisite for continued growth. Doing so, however, is easier said than done. At its core, driving innovation that supports business needs requires a new way of thinking about IT, which should be centered around increasing project delivery speed, and this is exactly what we are doing at Monet. For those of you who may not know, Monet Blockchain and AI is operating and in developmental phases as we speak within the global mobile healthcare sector. This project is expected to be completed within the next 3 years. Obviously, to operate within such a rapidly moving, progressively futuristic digital healthcare sector, I know it's quite mouthful. The only way forward is to adopting microservice architectures to respond more rapidly to the never-ending demands of our business. So by now, understanding why healthcare industry should be adapting disruptive technologies for reasons such as increasing legislative pressure to reduce healthcare costs and ever increasing competition, let's explore the significance of data, also the most overlooked aspect. So how does blockchain play its important role when it comes to data? In this multi-level ecosystem of healthcare, data is at the same time a powerful resource and a constraint. Complicated paperwork, massive delays, and miscommunication are one of the top issues attached to data management. This means that using, managing, and interpreting data is both valuable and at the same time the most challenging task. Blockchain has become a go-to solution in a data-heavy sectors, and healthcare is one of them. Research indicates that blockchain technology can be a converging point for health information. What converging point means in easier words is that because healthcare industry has become overloaded by data, blockchain can provide solutions to players in the sector to handle this datafied reality. So, the reason that blockchain is immutable and decentralized in its nature, it surely can be the most promising answer towards cutting costs, optimizing processes, and improving transparency. So, what are the benefits? Improving interoperability between different healthcare platforms such as hospitals, databases, insurance claims, pharmaceuticals. Next, blockchain has the potential to transform how pharmaceutical data is controlled, managed, shared, and acted upon. Number 3, storage and management of health records on blockchain platforms, allowing patients to protect their data and give access to them upon request, as well as improving information management between healthcare entities. Number 4, reduce centralized control over patient data sets and boosting medical research and treatment. Now on to AI, or artificial intelligence in healthcare. Over the period of time, a patient's health journey creates thousands of data points. Think in terms of changes in health conditions that may have improved or adversed over the years. As an example, a patient in his 30s was diagnosed with heart problem, later on develops any lung disease in his 40s, gets diagnosed with diabetes in 50s. His healthcare practitioner must be fully aware of his past history and specific symptoms that were recorded or reported at that time. This is where the existing and, to an extent, outdated healthcare systems fail. But with disruptive technologies such as AI or artificial intelligence, diagnostic errors are bound to drop significantly. Not only this, it also helps identify changes in the patient's health, enabling tracking of similar patient cohorts across institutions and geographies. This will eventually allow for comparative outcomes as well as predictive measures through artificial intelligence and machine learning. Now imagine synergizing blockchain and AI within healthcare industry. Now at this point, leaving you with this imagination, I'll conclude this video. Blockchain and AI are not just an option, but an essential missing piece of the healthcare puzzle achieving these benefits. The first one is pretty obvious, that it increases cybersecurity. Next, operational efficiency of the overall system is increased. Third, improved analytical capabilities. This means better management and identification of patients. Fourth is the lower cost of care with same or sometimes better outcomes. Fifth is expanded patient reach, for example, serving broader population through digital tools. Sixth, and most important, patient satisfaction. Seventh, and certainly not the last one, labor savings of reallocation of better access to care regardless of outcomes or cost-induced clinical outcomes. If you liked my content, please help me grow. Like, share, comment and subscribe to our channel. I'll see you in my next video.